surgical treatment for cartilage injuries and osteoarthritis. So, now we've identified a cartilage injury, and conservative treatments either didn't work or wouldn't work. That means it's time to talk surgery. In this video, which is the third and final video, we'll be talking more about cartilage and osteoarthritis, and we'll walk through the surgical options from small cartilage injuries to full-blown end-stage osteoarthritis. Keep in mind, cartilage doesn't heal well. That means most of our surgical options are workarounds, not true restorations of the articular cartilage. Once you've got advanced arthritis, we're not restoring a normal joint. We're now just managing the damage. Often we're talking about salvage procedures. To briefly recap the prior two videos, articular cartilage, the smooth caps at the ends of our joints that allow gliding, is a biomechanical marvel. But when it breaks down, there is no way of bringing it back. There are ways of preventing and mitigating damage, but sometimes surgery is needed. And because this is one of the more common issues globally, a lot of surgeries are done. Let's go through your broad exploration of surgical options. First, debridement, also known as chondroplasty. This is a basic cleanup. If there's a small, loose flap of cartilage causing catching or locking, we can smooth it out, often with just little instruments going through small incisions into the joint. Arthroscopic surgery. It helps with symptoms, but it doesn't heal the cartilage. The good news, recovery from this surgery is quick. Think of it as kind of sanding down a jagged edge so your joint does not trip over it as much. But it is not fixing the crack, which could expand over time. Then there is fixation of osteochondral fragments. This is often in a traumatic situation. There's been an injury to a joint, and if a chunk of cartilage and bone breaks off, sometimes we can reattach it or hold it all together using screws, pins, plates, other orthopedic implants, especially in younger patients with better healing potential. Remember, cartilage does not have a blood supply, and it heals poorly. But if there's bone with it, there's a chance of healing. If this works, then great, but the pieces have to be big enough to hold the orthopedic implants, and the cartilage still has been damaged, so even if the joint gets lined up perfectly, there's an increased risk of breaking down earlier than if you hadn't had the injury in the first place. Microfracture. This is also an arthroscopic procedure, and this was once a go-to. We would poke holes into the exposed subchondral bone, the bone underneath the cartilage that now has been exposed, to encourage a healing response. The body fills the gap with something called fibrocartilage. Unfortunately, it is weaker and breaks down faster than normal articular cartilage. It's really a short-term fix, and it's not ideal for any long-term durability or treatments. Cartilage transplants, also known as osteochondral autografts. Another term is mosaicplasty. These are forms of cartilage transplants from your own body, autografts. It involves taking small plugs of cartilage and bone from a low-stress area of a joint and transplanting it into the area where the cartilage has been broken down, into the defect. It's best for small lesions and can be done in just one surgery. Downside, well, you're damaging a healthy area to fix a bad one, and it does require time to heal. Another cartilage transplant that is out there is something called matrix-induced autologous chondrocyte implantation, also known as MACI. This is a high-tech option. We harvest your cartilage cells, grow those cells in a lab, and re-implant them within a collagen patch that helps it stay there. It's best in young patients who can heal better than anybody, but it's expensive, requires multiple surgeries, and takes months to recover. Then there are allografts. This is donor tissue. And these are used if the defect is just too big, we can't have enough autograft to fill it, or if you've tried autografts before and it didn't work. These grafts are supposed to contain living cartilage cells, living chondrocytes from someone else. So you can imagine there is a very small risk of things like infection or rejection or just not healing these transplants. Overall, because cartilage is such a metabolically inactive type of tissue, usually the immune system does not play a huge role in healing. MACI can be helpful, but clearly it's not a perfect surgery. Now we're going to start getting into truly the salvage procedures for end-stage arthritis. There is joint fusion, also known as arthrodesis. This is a last resort for many joints. This is where we fuse the joint to eliminate bone-on-bone grinding. The bones are angry, they're moving past each other, creating inflammation. If you keep them from moving, the pain can go away. You'll lose motion, but it may be worth it to gain the pain relief. This is best for small joints like fingers, wrists, feet, but as you can imagine, the big joints like the knees, the hips, the shoulder, people lose a lot if we start fusing those big joints. If the fusion works, and this does require time to heal, kind of like a broken bone, it can work very well in reducing pain. Then there's joint replacements, arthroplasty. This is the crown jewel of arthritis surgery. By cutting out the damaged bone and cartilage and replacing it with metal, plastic, and/or ceramic components, we can restore pain-free motion. Done right, it can be life-changing. Hip and knee replacements now last 25, 30 years, and the track record is solid. Shoulder placements are good. We're getting at least 15 years for many of those. With ankles, elbows, wrists, finger joint replacements, we're not getting them to last very long. Often they break down, and because of this more limited durability, we have to be very selective in which patients we consider for these surgeries. Part of the problem with replacing small joints is that the big, strong implants that would be used for joint replacements don't fit into small bones all that well. And then with these small joints, the forces that go through them are very complex and will cause things to break down faster. So, the question that everyone asks, when is the right time for one of these big surgeries? If you have documented osteoarthritis, the pain limits your life, and you've exhausted all other treatments, you're probably ready. Other factors like medical issues do weigh in on decisions for a joint replacement or arthrodesis procedure. Obesity, diabetes, smoking, and malnutrition are all associated with increased complications of these surgeries. Medical issues need to be optimized for good outcomes after any surgery, but especially these big joint replacement surgeries. If you've let yourself become deconditioned by not exercising, I get it. It hurts, then recovery is that much harder and slower after these big surgeries. So some final thoughts after now 3 videos. Your joints are living organs that thrive with motion, nutrition, and care. Cartilage is amazing, but cannot heal after being damaged. Arthritis is common. It is affecting hundreds of millions of people right now. While we don't yet have a cure, surgical options from minor cleanups to full replacements of a joint can give people their lives back. And hopefully, someday soon, we'll find better ways to restore what's been lost. Until then, keep moving, stay strong, and treat your joints with respect. Stay in the fight. I'm Dr. Lucius Pomerantz, orthopedic surgeon and board certified in lifestyle medicine. If this video helped you understand your options, please like, share, and subscribe so we can keep cutting to the bone. And get those notifications so you know when my next videos come out. Thank you again for your time.